let's talk about shoulder pain and all the possibilities in terms of what's actually going on and how you can ultimately fix it. So, my name is Dr. Michael Vanchieri. I'm an owner at Wildcard Spine and Sport, a non-surgical, drug-free chronic pain clinic here in New York City. And this is hopefully going to be the first of a handful of videos where I dive deeper into categories of pain and what's going on and what you can do to fix it. The intention of these will largely be structured in a way where we're going to go into some more nuanced, complicated topics than what you would see in a TikTok or a Reel or a YouTube short. So welcome. Hopefully you learned something, and let me know if you like these. So the objectives of this is, again, to provide the tools to improve your own diagnosis at home. Now, unless you are a licensed healthcare provider in the state in which you currently reside in, you're not going to actually come to an official diagnosis. We just want to give you more tools so that if you need to end up going to a provider, you can be more well educated. And we also want to provide you with interventions for each diagnosis. Some of these interventions you can hopefully do at home, as you can see by our third bullet point, but other interventions will help guide you towards practitioners that you should be seeing. When should you get surgery? When should you explore conservative options? When can you largely do things at home yourself? So the concept of a diagnosis is often overlooked in medicine. You have 4 categories for every person's diagnosis. You have a structural category, which is going to be bones and cartilage, a functional category, which is going to be muscles, ligaments, tendons, and nerves, metabolic category, which is going to be your internal health, right? High cholesterol, blood pressure, and it's going to largely be reflected as well in your body mass index and or body composition would be a more precise way to list that. And we'll go into some details there in terms of what you want to look at. And then psychosomatic, how is your mental health? Many of us like to blame mental health on a lot of our physical pain, and although it is a component of it, right, it's more of a heightener or a dampener, right? So the better your mental health is, the less pain you'll feel. The worse your mental health is, the more pain you will feel. Structural, again, bones and cartilage. We're going to go into a little bit more detail on each of the categories. Degenerative changes, so arthritis. When we look at the shoulder, you can sometimes get bone spurs. You can sometimes have anatomical anomalies from birth, right? So depending on, what category of acromion hook you have. Do you have a deep acromion hook? Do you have a shallow acromion hook? Degenerative changes is going to include kind of birth defects, which is a really aggressive way to put it, or again, generalized arthritis. I mean, you're not going to largely get any shoulder replacement surgeries, but those degenerative changes can affect things. And then we have the labrum, which is going to be the most common structural change in the shoulder, right? That piece of cartilage in there. Other things that you can look to understand, we can kind of include the AC joint degeneration in here as well, which we are going to. Functional, muscles as it pertains to the shoulder, right? Adhesion, scar tissue, and fibrosis are going to largely dictate muscle dysfunction and the measurable weakness to functional patterns. So I don't specifically get into, hey, the supraspinatus is weak or the infraspinatus is weak. It's more patterns relative to each other. So what's your single arm pressing pattern on your right versus your left? Right? Ligaments, what can happen to your ligaments in the shoulders? Again, you can adhere, you can scar, you can fibrose, all the same thing. You can get that largely in the joint capsule, which is what adhesive capsulitis or frozen shoulder is, and you can obviously get that into the AC joint, especially if you've had a history of AC joint dislocations. Tendons, where can we run into tendon issues in the shoulder? Well, obviously the rotator cuff tendinopathy, so that includes tears, right? Tendinosis, tendinitis. We look for biceps tendon. We can group into the tendons of the shoulders. And when you look at tendinopathy, in particular tears, you have to differentiate between full thickness, which that tendon is completely torn, or a partial tear, where there are still some continuous fibers from the tendon origin to the actual bone origin. And then tendinosis is a really important one too. That is a disorganization of the tendon pattern. Nerves, right? Where do we run into issues with nerves in the shoulder? Well, largely the neurovascular bundle at the subscapularis. It's right underneath, up in through that armpit. It's where you have a brachial plexus. You can get those nerves stuck down. Metabolic issues when it pertains to the shoulders, because this is a systemic issue, most metabolic conditions will not just target a single area. There's no specific metabolic thing that makes your shoulder hurt, with the exception of frozen shoulder. Many, many times frozen shoulder comes with a component of diabetes, right? Typically you're older, you're diabetic, and you're female for some reason, right? Those are the three main categories that we look for frozen shoulder. Anything where you have an elevated BMI, so a body mass index over 25, is going to be something that we look for as a risk factor. Now, there are some individuals, in particular men, but women can easily fall into this category as well, where they have a higher BMI, but they aren't necessarily at a poor body composition. So for that, we have a waist to hip ratio that we can discuss in the future as well. But again, metabolic syndrome is basically being overweight to the point where it is causing metabolic deficiencies. Autoimmune diseases can also contribute metabolically to pain. You're obviously looking at something as obvious as rheumatoid arthritis, but something very simple like PCOS, for instance, which is more and more research is suggesting there is an autoimmune component to that. Can also result in joint pain. Poor sleep, right? Metabolism is stress, diet, sleep. Not sleeping well will cause a decrease in your recovery, making you more prone to feel pain. Macro deficiencies, most commonly protein. You're not consuming enough protein to actually repair muscle tissues. And mineral deficiencies, right? Vitamin D is an important one. It's going to regulate sex hormones. And magnesium, which is a natural mineral muscle relaxer. Psychosomatic, this is your mental health. Right? Where do we run into issues with mental health in terms of just the body in general and or specifically the shoulders? Well, it really starts with the belief that you can actually get better. That sounds like some hippy-dippy BS, but at the end of the day, the more you believe that you can get better, the more likely you will. I can't explain it. It is what it is. Eating disorders. This is a really huge one. And again, I'm not an eating disorder specialist. I do not claim to fix people's eating disorders, but undereating can very, very easily cause nutrient deficiencies, and you can list that as a psychosomatic issue before you list that as a metabolic issue. And again, binge eating, things like that can also increase your body mass index, your body fat, making it harder for you to recover and more likely to develop long-term chronic pain. Overtraining under recovery. This is a huge one. Most people don't think of this as a mental illness, but it really, really is. Those individuals that feel like they have to train 14 hours a week in order to maintain a certain body composition. There's something going on from a psychosomatic standpoint that needs to be addressed. And again, any increase in lifestyle stress. So you have a job that's really stressful. You're an emergency room nurse. You're somebody that has to crawl into sewers in order to help maintain the cleanliness of New York City, right? A lot of people rely on you. It's high stress. It will increase your cortisol, making you more inflamed, hurt more easily, and less recovery. So how do we develop that diagnosis and put things into particular categories? Well, the first thing is imaging, right? Imagining, that's a typo there. So imaging, excuse my poor spelling there. MRI, right? In particular for shoulders, contrast MRI is what you want. It helps see the actual cartilage of the joint, right? A contrast MRI is much more sensitive to labral issues than a normal regular MRI. So it's hard to get those authorized by your insurance company, but do your absolute best. Get in there. Complain of chronicity, complain that it hurts, 10 out of 10, can't lift my arm, get the MRI that you need, ask your doctor, right? You see all these pharmaceutical commercials where it's like, ask your doctor if using this drug is right for you. Ask your doctor to get a contrast MRI. X-ray is pretty good as well. It's going to largely indicate structural issues in terms of the bone, right? MRI is best for soft tissues, so tendons, cartilage. X-ray is good for bones. You will likely always get an X-ray before you get an MRI. EMG can be an important one to help differentiate locations of nerve entrapments. So I don't see a ton of EMGs done on the brachial plexus. They're largely done more downstream in the median nerve, radial nerve, things like that, but they can help differentiate nerve entrapments. Physical exam is going to be massively important for the shoulder. Range of motion. Can you abduct your arm all the way up to your ear? That's going to help us differentiate between any adhesion in the rotator cuff. Orthopedic exam and or tests. Speeds test is going to really help you with biceps tendonitis. Subscapularis liftoff is going to do subscapularis tendinopathy. O'Brien's test is going to differentiate things for your labrum, right? You've got an empty can raise for supraspinous ligament. So that's huge. It's going to differentiate a lot of those tendinopathies and cartilage breakdowns with the orthopedics. Waist to hip ratio, right, is a huge one. Physical exam allows us to determine things metabolically. I don't often take a tape measure out for somebody and I'm like, hey, listen, your waist to hip ratio is pathologic. You really need to fix that. You can eyeball it sometimes, but waist to hip ratio for women should be under 0.8 and waist to hip ratio for men is under 0.95. Palpation. This is the king of all physical exams. Somebody goes in there who is skilled and actually feels what is going on. Where is their adhesion? Does it hurt when I press in on your tendon? How does it feel when I dive into your joint capsule? Really, really important things. And then other consults, right? You won't always get all this information from a singular doctor. You know, I'm the one that really believes of referring people out, right? A clinical nutritionist can help with a lot of metabolic things. A behavioral therapist / clinical psychologist can help with a lot of the psychosomatic things. An orthopedic surgeon can help with many of the structural things. So it's not just going to be a one-stop shop for you to understand what your complete diagnosis is. Oftentimes when people come into my office, they've already seen an orthopedist, right? They've already seen a primary care doctor. They're exploring options nutritionally. They're going to see therapists. They're doing all the work that they need to do. And I'm the last person they see, so I have all this information in front of me beforehand, and all I really need to do is my physical exam. So let's get really specific about some of these structural issues. So again, bones and cartilage, osteophytic changes, you can manage them, right? And this is how we're ultimately going to fix these things. You can manage it by clearing adhesion. So making sure that the muscles, ligaments, and tendons around that osteophytic change, that bone growth, those structures are in good shape. If you're looking to get rid of an osteophyte, surgery is the only real option to fix it. So if that thing is huge, and we remove all the adhesion, we improve all the tendons, and you're like, yeah, man, that thing still hurts. Go get that stuff shaped down. It's not fun. It's not comfortable, but it will provide you with long-lasting relief. Generalized arthritis, so basically joint degeneration, a decreased space of the joint. Shockwave therapy works really, really well there. You're going to get a 15 to 30% reduction. You're going to get my headphones just screamed at me. You're going to get a 15 to 30% on average change to that general arthritis, which will result in the adequate and or appropriate pain profile decrease. Shoulder replacement surgeries are an option there. They're not used very, very commonly. I would imagine that as technology improves in the orthopedic space, you'll see more and more of those, especially with an aging population that, quite frankly, experiences a lot of pain. Okay, labral tears. We're going to talk about the most common one. You can have a Bankart tear, you can have an inferior tear, but the slap is the most common tear that we get in the office. And types 1 and 2, where it's not like a complete shave off of that labrum, shockwave therapy is going to work really, really well. Again, 15 to 30% reduction depending on your metabolic health, depending on your age, in conjunction with clearing all the adhesion, ensuring that strength is adequate, and making sure the tendons are healthy is what most people need. Is what most people need to feel much, much better. So again, if you're a baseball player, you might need surgery still, even if it's a type 1 or 2. Types 3 or 4, right? We're leaning a little bit closer towards surgery. We can try to do some shockwave depending on what your lifestyle affords, but it's a surgical repair otherwise. It's best to get shockwave done first, clear out some of that senescence, and then get the surgery done so that stem cell production is really high as you repair. But you're likely going to need surgery if you're using that shoulder for any real type of work. Functional shoulder issues, right? This is, again, muscles, ligaments, tendons, nerves, adhesion to rotator cuff and latissimus dorsi muscle, shockwave therapy. It's a slam dunk. Google search shockwave therapy, fibrosis, scar tissue, shockwave therapy, senescence, regeneration, stem cells. You'll find wonderful information. Adhesion to the capsule and the AC joint, shockwave therapy. Again, it just does such a wonderful job of breaking down scar tissue. AC joint gets a little bit hairy. There are times where I'll use a traditional instrument to kind of scrape through some of that stuff. It can be quite a painful thing to have a shockwave on a degenerated AC joint, the ligament, excuse me. But it does work very, very well. Tendinosis, right? Here's where we start to get a little murky as well. Shockwave works wonderfully there too. Again, you're looking at a 15 to 30% reduction in symptoms and or regeneration. If it gets severe, what we've found at the clinic is that PRP and or stem cell injections in conjunction with shockwave therapy gets people wonderful results. We go in there for 4 visits. We kill a lot of the senescence. We start the regenerative process. Then you go and see a regenerative doctor. They'll spin your blood down. They'll grab some stem cells. They'll inject it in there and kind of give you a hyper boost of regeneration. Severe cases require surgical repair. Freudian slip there, because severe cases will eventually tear. So sometimes they'll go in there before that thing fully tears and they'll clean it right up. Tendon tears, partial shockwave therapy, PRP, stem cell, same thing as a tendinosis there. You can get good regeneration of that tendon, probably not as good as a tendinosis, but a full thickness, right, depending on your lifestyle, is likely a surgical thing. Again, if you're using that shoulder for any type of actual real work, get that thing operated on. Metabolic issues. Always a touchy subject for us to consume. We're going to breeze over this. I'm going to give you some general information. Again, your BMI has to be under 25. If it's not under 25, your waist to hip ratio has to be under 0.8 for females and 0.95 for males. The best way to manage that and get that down is a 200 to 500 calorie deficit. I don't care how you achieve that. If it fits your macros, zone diet, keto, blah, 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 don't care. You do have to get 0.7 to 1.0 grams of protein per pound of body weight. That's a little higher than what most recommendations will say. But if you're losing weight, more protein is typically better, because it's not an efficient macro to break down, so you'll actually burn calories to get to the calories from protein. If you go keto, that 25 to 35% daily calories from fat is obviously going to go up. You'll have to, complement that with the decrease in carbohydrates. The more autoimmune you are, the fewer carbohydrates in general you will need to consume or want to consume. Now, they can be good carbs, bad carbs, bit of fruit, white bread, fiber tortillas, whatever the case may be. In general, for most individuals, lower carb works better for autoimmune diseases. Okay. Intermittent fasting is another really good one. Now, there are obvious populations that shouldn't intermittent fast: children, pregnant women, those who have a previous history with eating disorders. But caloric restriction, more or less medical starvation and medical gorging, that's not a great way to put it. When you restrict calories, it decreases senescent or zombie cells, and you get a boost on that when you restrict your feeding times. Okay. Other things that you can do to improve your metabolic issues are improve sleep, 7 to 8 hours at least. Cold temperature, I like 69 degrees. 68 works really well. That's where largely a lot of the research is. So if you sleep in a hot room, if you're European and you hate the window open because you think, some demon's going to blow into your room and make you sick, then you're going to have to fix that. Darkness, try to block out all light forms. Get room darkening curtains. Put electrical tape over this and that. Get yourself a clock that really doesn't emit a lot of light, and try to put your phone in another room. And consistent sleep and wake times. This is the thing that I'm working on the hardest right now in terms of my sleep. There are some days that my work requires me up at 5:30. There are some days where my work doesn't require me to be up at all. I'm trying to bring that range down. I'm trying to get up every day at 5:30 so I can get into a consistent circadian rhythm. Supplementations for Metabolic issues. This is not medical advice. Google search these, do your own research. This whole thing is not medical advice officially, by the way, unless you are currently in care in my office for a shoulder issue. This is not official medical advice, for educational purposes only. Resveratrol, berberine, quercetin, turmeric / curcumin all reduce inflammation, and some of them actually are shown to increase autophagy and decrease senescent cells. Psychosomatic issues. Consult with a mental health professional here. I am not an expert by any stretch of the imagination here. Go to a therapist, behavioral therapist. I like those the best typically, or a clinical psychologist. Lifestyle changes can mean a big difference too, right? If you're depressed and you fix your sleep, sometimes that can help with depression. Improving your nutrition. There's a very, very strong brain to gut connection. In fact, the brain and the gut are the only two organs in the body that have mu receptors. So very, very important link there, right? Your brain will connect to your gut with a variety of autonomic nerves. So if you improve your nutrition, a lot of times it improves your mental health. Meditation, prayer / time in silence also helps a lot with psychosomatic issues. So again, this isn't a fix-all. I'm not a mental health provider, but if you aren't spending some level of time in prayer, meditation, or silence, or whatever each day and reflecting, you're leaving some opportunity for improvement on the table. At-home interventions, right? This is what everybody's been waiting for. Thank you for being patient. If you are still watching, mobility exercise is the very best mobility exercise for shoulder pain. This is supinated grip bar hang. And again, all of these videos are currently on my YouTube channel. You can look them up, very easy. I have a free 4-week flexibility program. I'm working on a lower back program for, lower back home exercise program. Shoulder will be done relatively quickly depending on when you're seeing this, but very shoulder-specific rehab exercises. Again, these are all on my YouTube channel. Beginner shoulder external rotators, yoga push-ups, bears, crabs, and carries, farmer carries, and overhead carries. In general, a good beginner level strength test for shoulders are, can you do 5 push-ups? If you can do 5 push-ups really, really nicely, really, really slow and controlled with beautiful form, you're probably in the advanced section, which you would use single arm upright rows and single arm presses in general. If you have any specific questions, feel free to reach out to me. Again, I've got a myriad of different exercises on my YouTube channel that you can check out. Nutritional interventions are obviously something you're going to do at home, right? Go through the things that we talked about in the previous slide, and you should be okay. Again, it's all about managing inflammation and body weight. Body weight is the first thing, then you get specific into inflammation. Thank you. That's it. I tried to go through a lot of information. It's about 22 minutes have passed by. That's probably more than most people are watching. I'm going to try to throw bookmarks into this video so it's a little bit cleaner. Again, all exercise demos, at-home care, found on my YouTube page. My Instagram is Wildcard Spine and Sport. My TikTok is Get Wildcard. My website is linked in a million different places. Look it up. My email is linked in a million different places. Look it up. Let me know what you think. I hope this was educational. If this gets good traction and people view this and comment on it and engage on it, I'll continue to work through the other areas of the body, mainly the neck, the hip and lower back, the knee and ankle. We'll try to break it up into nice, easy areas, and hopefully you can figure out some more and learn about your condition and be more educated on your body. Have an awesome day, guys. Thanks. Where is this thing?